Well, in neighbouring Venezuela, a deep economic crisis, one that has worsened with the COVID-19 pandemic, is putting lives at risk. Women are now having a hard time finding affordable birth control methods, which also means a loss of control over their lives and the potential to make desperate decisions. CNN's Rafael Romo explains.
Women start lining up very early in the morning. It's just impossible to find contraceptives elsewhere, this woman says. What all of them have in common is that they're seeking subsidized women's health services at this independent clinic in Caracas, affiliated with the International Planned Parenthood Federation. In the Venezuela of the oil boom, and even during the first few years of the Hugo Chavez mandate, who declared himself not only a socialist, but also a feminist,
Soy feminista.
The government offered free women's health programs. Contraceptives, condoms, and other birth control methods were offered at no cost. But after several years of a deep financial crisis, the current situation is dire, according to this administrator at the Women's Health Services Clinic. For example, she says, we now have more unplanned pregnancies, which are happening to younger women. We're also having higher rates of maternal mortality. Scarcity of birth control methods reached a level of a whopping 90% in 2018, and it has since improved to 50%, according to a report by the Venezuela Association of Alternative Sexual Education. But scarcity is not the only problem. We don't have money to pay for them, this woman says. Minimum wage is not even enough to buy food, much less contraceptives or other kinds of birth control. Contraceptives that used to cost 5,000 bolivars, the local currency, are now around 20 million, some $10.60 at the official exchange rate, according to Freddy Ceballos, president of the Venezuelan Federation of Pharmacies. And since 95% of pharmaceutical products are imported, the industry depends on the U.S. dollar, a currency that has gone through the roof in the last few years. Couples and women have to decide between buying food and getting contraceptives. That's the reality, Ceballos says. CNN recently visited several conventional pharmacies and also checked online and found that condoms cost between 2 and 8 million bolivars, from $1 to $4. Contraceptives between 24 and 36 million, from $13 to $19. And IUDs as much as 216 million, or $115. For most women, those are unaffordable prices, especially considering that the monthly minimum wage is 1.2 million, or 65 cents of a dollar, according to the official exchange rate at the Venezuelan central bank. This situation means women's health in Venezuela is as bad as it was several generations ago, according to this expert. We could say that we're in the same situation our grandmothers and great-grandmothers were. And what are the implications for women? Number one is that they end up trapped inside the home, Leon says. Not that there's anything wrong with being a mother or a housewife, she adds. The problem is the lack of choice and the risks that women are exposed to. According to Leon, effective women's health programs were replaced a few years ago by seasonal campaigns whose reach is insufficient. An official at the Venezuelan Health Ministry contacted by CNN recognized the government has indeed had difficulty getting enough birth control supplies, but blamed U.S. sanctions, saying that they also have had negative effects on importing food and medications. Meanwhile, at the Caracas clinic, women keep waiting, hoping that one day they won't have to stand in line to get pills to avoid unplanned pregnancies and get the health services they need to live safer lives. Rafael Romo, CNN.